Okay, so welcome back, gentle students. Today we are diving to a real life threat that can happen anytime in your dental chair. That is hypersensitivity reactions or allergic reactions. So basically, it can start from a simple skin rash to a full-blown anaphylaxis. It is critical, how to recognize and manage each form immediately. So the first thing is starting from the delayed onset skin signs. Slow, but it could be dangerous. So, talking about the skin signs, just picture this: a patient leaves your clinic after a filling and calls back an hour later complaining of a red itchy rash. This is a delayed skin reaction. Okay, so that is some example that you can imagine. So here, the things you can see symptoms. Look at those symptoms are given here: arrhythmia, urticaria, pruritus, itchiness, and angioedema, swelling. All these written here are important. So basically, these are the symptoms you have to for for skin signs. So that's it is. But what's next? What to do? So looking at the management. What we have to do is on these management. The first thing coming up is like stop all the drugs you're giving. Okay, then go for IV or intramuscular Benadryl. 50 mg. Go for it, or a chlorpromethazine 10 mg, and then just refer the physician. Okay, so that's how it is gonna managed. Okay, so consult your physician, or if somebody is for at home treatment, Benadryl 50 mg every 6 hours, or chlorpromethazine 10 mg, possibly with a tapering dose of prednisone. So these this home and all these are the management of early skin reaction. Then we got immediate onset. What is immediate onset? Now imagine the rash appears right in front of you just after giving LA. You just given local anesthesia and the patient got rash. What's next? That's immediate hypersensitivity. So it includes same some things that are same like arrhythmia, urticaria, pruritus. Okay. So what is this management? It's written down here. Okay, sorry for that. Okay, this is its management. They just made it. Now it's gonna be easier for you. So looking at its management, administer hydrocortisone 100 mg and dexamethasone 8 mg or methylprednisolone 125 mg. So these are basic corticosteroids we can go for. Then monitor the vital signs, consult the physician, keep patient under observation in the clinic for 1 hour is quite important, and prescribe antihistamines and corticosteroids. So that's how we have to deal with the skin rashes. Then we got the respiratory signs. Respiratory signs, it could be with or without, given that skin or cardiovascular signs. So, what if the patient start wheezing or feel short of breath suddenly? So, if it could be mild wheezing, as it's saying mild wheezing, so it you have to do following things given here. Just look at it. We have to stop all the drugs. Okay, sit the patient upright. You have to remember these positions. These are very important for exams. And then use two puffs or two puffs of a beta agonist inhaler. It could be salbutamol. If needed, give hydrocortisone or dexamethasone and monitor. If cardiovascular signs appear, give epinephrine. So that's how it's gonna be important for you guys. So these are the points you have to read once, and that it could be helpful for you. Okay, then we are coming to the next part, that is severe respiratory signs, stridor or moderate, it's like now you hear a harsh growling sound. That's trident. Okay, you have to complete just make your concepts clear. It's like this, like a sound coming out of the patient mouth, and it's a medical emergency. Okay, so the first thing, as we said before, stop all the drugs, sit the patient upright, call emergency help immediately, and and you have to give oxygen by face mask, sit the patient upright, administer epinephrine. Okay, administer epinephrine plus oxygen 6 liter a minute plus antihistamine per corticosteroids. These all are written here, and prepare transport to the hospital. So these all how it's gonna be prevented or managed. Then we got the important one, also known as anaphylaxis. It is a full-on emergency. It's a full-on emergency. Always remember, I just made a ambulance slide here. Full-on emergency. This is the worst case scenario. Full collapse. Your patient may become cyanotic, collapse, vomit, or even go into a cardiac arrest. So it is something to be considered of. So the first thing first, stop all the drugs. Okay, position the patient supine on a backboard or floor. So this is something important. Spine position is important. Then administered epinephrine immediately, and then start BLS basic life support, give oxygen as we have said before. If trained, perform cricothyroidectomy. This is something that is performed by uh, trained dentist or OMFS. So then call for emergency and prepare the transfer. These are some things we have to consider. A key message to the students, we just did allergic reactions. Some things I'm going to tell you guys is that whether it's a mild rash or a full collapse, your role in recognizing early signs so you can save a life. Okay, so the most important, you have to understand the skin signs, you have to learn them. Then the all things common in this is that stop administration of all drugs. That is very important. Then if administer epinephrine if signs of cardiovascular compromise or airway obstruction are present. Okay, and also understand that stridus breathing and anaphylaxis shock, just treat them as same because they both are medical emergencies. Okay, so that's how it is from allergic reactions. Now coming to another thing, just you have to have a topic that could become from here is like, what is the difference between immediate versus delayed sign and coming rashes, and what could be the drug of choice for anaphylaxis, and route for epinephrine, IVIM, all these things you have to understand. Okay, so that's how we have to cover the allergic reactions. Now coming on to the next slide, we have to cover this too. So here we go. Okay, so looking at this, we have to understand one thing, that managing allergic reactions, and we got chest discomfort here too in the dental clinic. So but you have to understand these are two different. Allergic reaction and chest pain are different. So controlling the allergic reactions, I have to tell you that even after treating the reaction, the danger is not over. Why? Because the allergen may still be in the patient system. Okay, that's a point you have to consider. The pay because the allergen may still be in the patient system. So we have to continue with oral benadryl, okay, 50 mg, or clotrimazole 8 mg. So that's written in the first paragraph. These are the drugs you have to take care of. Okay, so I'm underlining them. Every 6 8 hours for 24 or 48 hours. Then immediate urticarial reaction if the patient breaks into severe hives during treatment. IVIM corticosteroids are your go to. Okay, so this is something you have to understand, that the patient can go into something we have to take care of. Administer hydrocortisone 100 mg. Okay, we have to give 100 mg of hydrocortisone, dexamethasone of 8 mg, and methylprednisolone. All these things we have to give. Wheezing and lower. If the person uh, now imagine the patient start wheezing. This is serious. Now we have to act very quickly. So what to do for it? We have to lower respiratory involvement. So we have to first call for emergency help. Okay, first thing first, call for emergency help. Then we have to place in semi-reclined position. Okay, semi-reclined position is something that is suitable for the patient. So that's here it is written semi. Sorry for being going out of this, but you have to just learn it when I'm saying that. Then we have to start nasal oxygen. Okay, give 2 puffs of albuterol. Repeat if it's improving. If everything worsens, give epinephrine. 0.3 ml. That's written here. Or and we have to repeat in 5 minutes if needed. That's it is. You have to learn. Just go through these signs from the book. Now we are coming from signs of laryngeal obstruction, also known as strident. Stridor is a loud crowing sound as actors in an emergency, like someone gasping through a blocked, airway. So management is quite easier. Immediate IM epinephrine 0.3 ml. Okay, written here. And then we have to give oxygen. If patient loses consciousness and cannot be ventilated, then perform emergency cricothyroidectomy. That's it is written here. It is something if you're trained, okay? Remember, cricothyroidectomy is the real emergency way, not tracheostomy. Tracheostomy is something not done in the emergency. So that's how it is. Okay, so we are coming with if the patient shows sign of cardiovascular system. Okay, so cardiovascular system, so if you see hypotension, bradycardia, cardiac arrest, this is no longer just an allergic reaction. Then we have to start with basic life support, monitor vital signs, and prepare for emergency transport. So I think we have to cover other emergencies in other parts. That's how it is. I hope you got to know about the allergic reaction, and I have made it easier. So if you got any questions, you can comment down below. I'm gonna answer that. And you please don't forget to like and subscribe. That will motivate me, and I will put my more effort and work to make this Tucker or surgery easier for me and many more, chapters and topics of other dental uh, books to come. Thank you for watching. In the next part, we will do chest discomfort. Thank you very much.